Dear students, welcome back. So now we are going to see the radial nerve. Radial nerve is the continuation of the posterior cord of the brachial plexus. So we know that the posterior cord is formed by the all posterior divisions of all the trunks forms the posterior cord. This is the posterior cord. So it descends behind the third part of the axillary artery. So in the axilla, we know that subclavian artery, axillary artery, and then it is continued as the brachial artery, isn't it? Yes. So it lies behind the third part of the axillary artery and upper part of the brachial artery. Okay, so it is the continuation of the posterior cord of the brachial plexus. It descends behind the third part of the axillary artery and upper part of the brachial artery. So here the brachial artery is present. So in the upper part of the brachial artery, so this radial nerve is present behind this brachial artery. Okay, and also some of the muscles which are present below this radial nerve from above downwards are the subscapularis muscle, latissimus dorsi, teres major and long head of triceps are present behind this nerve. Behind this nerve. Okay. Next, it leaves the front of the arm. So now the nerve leaves the front of the arm. The nerve leaves the front of the arm between the long head and medial heads of the triceps along with the profunda brachial artery. It is a branch of brachial artery to enter into the spiral groove. This is the spiral groove. So here you can see the differentiation of colors. So the nerve is having two colors here. One is the thickened part, another one is the light yellow color. This light yellow color, wherever you see this light yellow color, they are present on the posterior aspect. Okay, now so this radial nerve leaves the arm by passing between the long head and medial head of the triceps along with the profunda brachial artery to enter into the spiral groove. To enter into the spiral groove in the posterior compartment of the arm. In the posterior compartment of the arm. After passing through the spinal groove, it re-enters the lower and lateral part of the anterior compartment of arm by piercing the lateral intermuscular septum. Along with the anterior terminal branch of the profunda brachial artery. Okay. So here the radial nerve leaves the upper part of the arm by passing between the long and medial heads of the triceps along with the profunda brachial artery to enter into the spiral groove in the posterior compartment of the arm. After passing through the spiral groove, it re-enters into the lower and lateral part of the anterior compartment of the arm by piercing the lateral intermuscular septum along with the anterior terminal branch of the profunda brachial artery. It then descends. So here it is piercing and it is descending down. So it descends in between. So we know that the lower part of the uh, humerus, giving origin to the brachialis muscle. So medial it is having brachialis muscle. From the supracondyle ridge, we know that two muscles are getting originating. One is the brachioradialis and extensor carpi radialis longus. So after descending at the lower end, it passes in between these muscles. One is the brachialis on the medial side and brachioradialis and extensor carpi radialis longus on the lateral side, and it enter into the forearm. So before entering into the forearm, it is entering into the fossa. What is that fossa? That is called as cubital fossa. Okay, cubital fossa. Okay, again we will see. So the radial nerve is present behind the axillary artery and also the brachial artery in the upper part of the arm, and it leaves the front of the arm by passing through by passing in between the long head and medial heads of the triceps. Along with the profunda brachiae artery, it enters into the spiral groove. After entering into the spiral groove, it winds the humerus and it comes to the front of the arm by piercing the lateral intermuscular septum, and it descends down and passes in between the two muscles, that is the brachialis on the medial side and brachioradialis and extensor carpi radialis longus muscle, and then it enters into the forearm. Okay, what happens in the forearm? In the forearm, the radial nerve descends between the brachioradialis and the brachialis. It descends on the lateral side of the radial artery. So here you can have the radial artery. Okay, and it has the same relations as that of the artery. So we know that in the cubital fossa, this radial nerve divides into two branches. One is the superficial branch and another one is the deep branch. Okay, the superficial branch continues on the lateral side of the front of the arm, continues on the lateral side of the front of the arm, and it is present lateral to the radial artery. And what are the relations to the radial artery is also related to this superficial branch of a radial nerve. So for example, you can see on the lateral side what are the muscles present. So this nerve is lying on this nerve is lying on the muscles like supinator here, supinator, pronator teres, flexor digitorum superficialis, flexor pollicis longus. So all these muscles are related with this superficial branch of what? Radial nerve. Okay. And then about 5 centimeters above the wrist joint, 5 centimeters above the wrist joint, it curves around the lateral margin of the forearm. It curves lateral margin of the forearm under the brachioradialis. We know that this brachioradialis muscle is getting inserted here. So below this brachioradialis muscle, this nerve is curving around the lateral margin of the forearm to reach the dorsum of the hand. Okay, after giving some tweaks, some small tweaks to the dorsum of the wrist, and the lateral side of the dorsum of the hand, So this superficial branch, it ends by dividing into 4 or 5. So normally 5, 4 or 5 digital branches. 4 or 5 digital branches. So this is the course of radial nerve as a whole in the upper limb. So now we will see the nerve supply, that is the branches of this radial nerve in the arm. So what are the things it is going to supply in the arm, forearm and in hand? Okay, now we will see that. So in the arm, so the branches of radial nerve in the arm are the posterior cutaneous nerve of arm. So it is having posterior cutaneous nerve of arm and lateral cutaneous nerve of arm. It is giving posterior cutaneous nerve of arm. It is giving one branch called posterior cutaneous nerve of arm, and also at the lower side it is giving lower lateral cutaneous nerve of arm. Okay, and also it is giving another branch called posterior cutaneous nerve of forearm. Okay, and it is also giving some muscular branches. So these three are the cutaneous branches in the arm. What are the cutaneous branches? One is the posterior cutaneous nerve of arm. Next one at the lower lateral cutaneous nerve of arm, and by the side of it, it is giving posterior cutaneous nerve of forearm. So two posterior cutaneous nerves and one lateral cutaneous nerve. So one posterior cutaneous nerve of arm and lower lateral cutaneous nerve of arm, and another cutaneous nerve is supplying to the forearm. So these are the cutaneous branches which are arising in the arm, and also it is having some muscular branches. It supplies to the main muscle, that is the brachialis. It is supplying to the brachialis, and also some branches to the triceps. One is the long head of triceps and the medial head of triceps. These are the two branches. So it is supplying to the triceps, long head and medial head of triceps, and also it is giving branch to the brachialis muscle and brachioradialis and extensor carpi radialis longus. If you can see, so these muscles are already related in the course. So along with the course, it is giving some branches to all those muscles. Okay, so these are the cutaneous supply as well as the muscular supply in the arm. Okay, and it is also giving branch to the extensor carpi radialis brevis also, and in the forearm it is divided into superficial and deep branches, isn't it? The deep branch is called as posterior cutaneous nerve of forearm. So the deep branch is called as posterior intraosseous nerve. The deep branch is called as posterior intraosseous nerve. Okay, what happened now? We'll see. At the level of lateral epicondyle, the radial nerve gives rise to the posterior interosseous nerve, that is the deep branch, which pierces the supinator, and passes through it and passes through it, winding round the lateral side of the radius, and to come to the posterior aspect. This is the thing happening at this level. So what is happening here? We will see again at the level of lateral epicondyle of the humerus. The radial nerve gives rise to the posterior interosseous nerve, that is the deep branch, which pierces the supinator and passes through it, winding round the lateral side of the radius to come to the posterior compartment of the forearm. Okay, before piercing the supinator, it sends some branches to supply extensor carpi radialis brevis as well as the supinator. Okay, now what are the branches given by this posterior interosseous nerve? Okay, so already we know that in the back of the forearm we are having two sets of muscles. One is the superficial set and the deep set. We know that the deep set is having 5 muscles and superficial set is having 7 muscles, isn't it? So the posterior interosseous nerve arises from the radial nerve at the level of the lateral epicondyle of the humerus. It passes through the supinator, dividing into a superficial and a deep one, and which is curving round the lateral side of the neck of the radius, entering into the posterior compartment of the forearm. So this is about the posterior interosseous nerve, that is the deep branch. So it descends between the superficial and deep group of muscles. It descends in between. So in between superficial and deep group of muscles. So it is descending in between them. So the deep branch is descending in between the superficial set of muscles and the deep set of muscles. Okay, on the posterior surface of the interosseous membrane, at the posterior surface of the interosseous membrane, it is going to end in a swelling on the posterior surface of the corpus, and it forms a pseudoganglion over there. And the upper part of the nerve is accompanied by the posterior interosseous artery, and the lower part is accompanied by the anterior interosseous artery. Okay, now this is about the course of the posterior interosseous nerve in the forearm. So again we will see. So after entering into the forearm, this nerve descends between the superficial and deep groups of the muscles and descends on the posterior surface of the interosseous membrane to end in a swelling on the posterior surface on the corpus. So as a pseudoganglion. The upper part of the nerve is accompanied by the posterior interosseous artery, and the lower part is accompanied by the anterior interosseous artery. Okay. So that artery which comes to this compartment by piercing the lower part of the interosseous membrane, this artery finally ends into the dorsal carpal arch. Okay, that one you have seen in the arterial supply, isn't it? So that anterior interosseous artery is related at the lower end of the forearm. Okay, now this is about the course of the posterior interosseous nerve. Now what are the branches arising from this posterior interosseous nerve. So already we know that before piercing the supinator, it is giving branch to the supinator as well as the extensor carpi radialis brevis. Okay, and then in the posterior compartment, it gives branches to the extensor digitorum. So extensor digitorum, extensor digiti minimi, extensor digitorum, extensor digiti minimi, and extensor carpi ulnaris, and also extensor pollicis longus, extensor indicis, abductor pollicis longus, and extensor pollicis brevis. Here you should know that it is having, these three branches are short branches and the remaining branches are long branches. So the short branches are the branches which are giving to extensor digitorum, extensor digiti minimi, extensor carpi ulnaris, and the long branches are the extensor pollicis longus, extensor indicis, abductor pollicis longus, and extensor pollicis brevis. So you can see here these muscles are deep muscles and these three muscles are the superficial set of muscles. Okay, so these are the branches given by the posterior interosseous nerve. These are the muscular branches, three short branches and remaining long branches. So the terminal branches here, the terminal branch form a swelling. I have already told that it forms a swelling and end up on the corpus. Okay, at this level, it gives some articular branches to the ligaments and the joints of the carpals and wrist. Ligaments and the joints of the carpals and wrist. Okay, this is about the nerve supply by the posterior interosseous nerve. So this is the end of the posterior interosseous nerve on the back of the forearm. Okay, now we have ended up here, isn't it? So now coming to the superficial branch. The superficial branch which enters into the dorsum of the hand, it is divided into 4 or 5 digital branches. So 2 branches to the thumb, medial side and the lateral side, and next branch, the second branch is given to the lateral side of the index finger, and the remaining 2 are going to divide into 2 slips, again 2 slips. So one is the medial side of the index and lateral side of the middle finger, and again the other branch, again it is giving 2 slips, isn't it? So that one is supplying to the medial side of the middle finger and lateral side of the ring finger. So as a whole, it is giving a nerve supply of lateral 3.5 fingers except terminal phalanges. The terminal phalanges are going to supply by the median nerve. That thing you can know. So this is about the nerve supply of the radial nerve in the entire upper limb. Okay, in the next video we will see the applied anatomy of the radial nerve. Thank you.